Hello, welcome to Social Work Live. Each week we interview members of the Columbia School of Social Work community to talk about what's going on in the world of social work. I'm Michael Friedman. I teach health policy and mental health policy here at the school. And we're going to have, I think, a very interesting conversation today with Jane Waldfogel, who is a professor here and recently back from Washington, where she testified about how to level the playing field for working families. So why don't we start by your telling us about your testimony.
Thanks, Michael. I was very happy to have the opportunity to testify in Congress. All of us on the policy faculty, this is why we do this work, and we imagine that one day somebody will call us up or email us and say, come on down to Washington and tell us about your exciting research. So when that actually happens, it's always very exciting. It was an interesting hearing. So I was the researcher in the hearing, and the other two witnesses were a grandmother who's raising a child with a disability, with autism, and then a woman who had 4 children and was taking care of her husband who had a disability. And then I spoke about, I was given 5 minutes to talk about everything I knew about paid family and medical leave and childcare. So that's quite a challenge to do that in 5 minutes.
It's a whole 2.5 pages.
Yeah. But what I learned was I could submit written testimony at the same time, and so the written testimony becomes an opportunity to back up all of those statements that you say very quickly in 5 minutes with lots of footnotes. So I think I was able to actually get quite a bit on the record.
So what was the thrust of your testimony? Let me just backtrack. Was this a House hearing or a Senate hearing or a
This was
combination?
a subcommittee of the Ways and Means Committee in the House, and was about both paid family and medical leave and child care for working families. And so, I've been at the school here for 25 years, and in those 25 years I've been working on paid family and medical leave and child care. The American family has changed. It used to be that families had a stay-at-home caregiver who could take care of the kids, take care of elderly relatives, take care of somebody with a disability or a serious health condition. This is not the reality anymore. Most families have 2 working parents, or they have a single parent who's working. So the idea that somebody's able to stay at home is just not the case anymore. But boy, our policies have not kept pace with that change. And so, we've got an Unpaid Family and Medical Leave Act. It's a great piece of legislation that came into effect in 1994. It provides job-protected leave for about half the workforce, and for a pretty generous set of conditions for up to 12 weeks a year, but it's unpaid and it leaves out half the workforce.
So which half of the workforce is not covered?
So you're not covered if you're in a smaller firm, less than 50 employees. That's the main exclusion criteria, or if you don't have sufficient work history. So in terms of paid leave, then, that leaves people reliant on their employer. So like other employer benefits, what happens is these are skewed. So not everybody gets paid leave from their employers. The people who get paid leave are the higher income, more affluent, more educated workers. So the people who need paid leave the most, if they're going to take time off work, are the least likely to have it. So in this kind of situation, the states have been stepping in. So we now have 6 states that have enacted paid family and medical leave, providing payment for what the federal law covers on an unpaid basis. So I've been working really hard with my colleagues to study these state laws and look at the impacts on employees and their families, but also the impacts on employers.
So who pays if somebody has paid leave?
Super good question. So one of the myths in the United States that we've been working really hard to counteract is the idea that when you talk about paid leave, you're talking about making employers pay. That is not at all the case. So these paid leave programs, the way they work is they're social insurance. So everybody in the state pays a small amount, pennies a week, into a social insurance fund through payroll taxes, like we all pay for Social Security, or we pay for unemployment insurance, Medicare. Right. And then if you have a qualifying condition, if you have a new baby, mother or father, you have somebody in your household with a serious illness, it could be your child, it could be your spouse or partner, In some states, it could be your grandchild. It could be your parent. It could be your grandparent that you need to take care of. You're able to take leave, and you claim from that social insurance fund, and it replaces part of your wages. So while you're out, your employer actually doesn't have to pay you. So once employers realize this, that their employees get to take the leave that they need without the employers having to pay them, the employer opposition really melts away.
So there aren't employers who say, but wait a second, you're going to be out for 12 weeks, and I'm going to have to hire somebody to fill in for you during that time.
No, so actually, we've been surveying employers, so it turns out that 90% of the time when employees are out on leave, the work is assigned to another employee. So it's 10% of the cases that the employer has to hire a replacement worker. So yes, sometimes employers have to hire a replacement, but they have the funds to do it because while the person's out on leave, they're not paying their salary.
That's interesting.
It's really people really don't know it. So we've been surveying employers in the states that have these laws, and we've gone to small employers and across a range of industries, including industries where it's really hard to cover when somebody's out. I mean, like manufacturing.
Right.
Somebody's off the line. It's really tough to cover. Fast food is another, fast food. It's a fast-paced work environment.
You have to have somebody there.
You have to have somebody there. And we've heard every state we've surveyed, 2/3 of the employers are either supportive or very supportive of the laws, and another 10 or 15% are neutral. So you add that up, there's maybe 10 or 15% that are opposed.
So you would think
we're looking at who those employers are and trying to understand, what the problems are they're having. But the vast majority of employers, this is not a problem.
So you think that there's political support out there for this kind of change?
Yeah.
And are you advocating for this change on a state-by-state basis, or would you like to see it happen at the federal level?
Yeah, I think state-by-state is a nightmare, and, even the employers are speaking up about this because the employers who are operating in multiple states, it's a nightmare. So if they're in New York, it's one set of rules. If they're in New Jersey, it's another set of rules. If they're in Pennsylvania, it's another set of rules. It's really difficult for them to cope with. So we already have a federal law. We have an FMLA. So I think the simplest thing would be at the federal level to have something that would be the equivalent of a paid FMLA, but covering all workers. We can't be excluding half the workforce. Half the workforce was excluded originally because we thought it would be too hard for small employers. But we've been surveying small employers. People usually don't include them in surveys, but we specifically did include them, and they're as supportive as the larger employers. So it turns out there's no reason you need to exclude small employers.
Is that their official position? There's an association that represents
so it's not the official
small,
position.
Right.
No, it's not the official position. So we're not surveying the Chamber of Commerce or the small business organizations.
Right.
We're calling firms, our survey firm is calling firms. We couldn't get these guys on the phone. They're too busy. These are fast-paced employers,
right.
So we have a survey firm that calls them, and they ask to speak with the line manager, and they're asking the line manager in these firms what they think about the laws.
So there's some incongruity then, if that's the right word, between the associations representing the interests of the business community and the actual business operators.
Right. Yeah, I don't have any comment on that. Yeah.
Oh. But that then suggests a political strategy, I would think.
Yeah, no, I've been talking all over the place about these employer results, and they're posted, they're on the web, because we don't have that much direct information from employers. And so, the data are a gold mine, and I hope they'll be influential.
I'm curious what response you got from the subcommittee of the Ways and Means Committee. The Ways and Means Committee, of course, is the money committee of the House, so it's the right place to be if you're going to talk about something that involves any money. And I would assume that they were cautious about adding spending.
Well, this was a hearing they scheduled. They invited me to testify. So I think they wanted to hear about the need and about the research. So that's why they invited the two women who are caregivers and, me as a researcher. No, I have to say I was struck by, they had said at the beginning of the hearing, we've blocked out 2 hours, we may not use the 2 hours. And honestly, I've testified before when the other side of the room, where the committee members sit, is pretty empty.
Yeah.
Sometimes these hearings are quite pro forma. This was a packed bench of committee members, and there were also some members of Congress who were not on the committee but had requested permission to come because they're so interested in the issue and their constituents are so interested. And that was on the Republican side as well as the Democratic side. There were additional Congress people who came along and asked questions. We used the full 2 hours. And the other thing that was striking was both...
2 hours for the three of you?
Well, there was also a Republican witness who spoke about job training and getting people into the labor market.
It's still an enormous amount of time.
Yeah, I mean,
with
each
four
of us,
witnesses, usually it's the 5 minutes that you talked about.
No, the
a
Q&A
question
went
or
on for
two,
about
and
an
then-
hour and a half.
Wow.
Yeah. And
That's
what
very
was-
impressive.
What was striking was both on the Democratic side and the Republican side, each of the members spoke about their own personal experiences, either growing up and the struggles that their parents had, or the struggles that they've had as adults, their family members, or what they've heard from their constituents
And
about.
was that focused on the maternal-paternal leave, or did it focus more on getting help dealing with people with disabilities in the family? Was it talking about the grandparent experience?
Yeah.
So many children these days are raised by their grandparents.
Absolutely no, and I thought it was really smart of the committee staff that the opening witness was a grandmother who's caring for a child with a serious condition, autism, and she was talking about her challenges in accessing benefits because she's a grandparent. So she was having trouble getting childcare subsidies to help cover the cost of care because she's a grandparent, and not in every state or not under the FMLA, would she be guaranteed. The laws vary in terms of whether they cover grandparents and grandchildren. So I thought it was really smart of them to have a grandparent. You and I were talking earlier, I think about 90% of the research on family and medical leave has been on parental leave, and about 90% of that has been on maternity leave, including my own work. And so we're trying really hard now, myself and my colleagues, to branch out and make sure we pay attention and we talk about the other conditions. So the single most common reason that people use FMLA, family and medical leave, including these paid leave programs at the state level, is for their own illness. So that's medical leave. The second most common, absolutely, is parental leave. So mothers or fathers taking leave to care for a newborn or a newly adopted child or a newly placed child. The third most common reason, it's tiny, but it's really important, is family caregiving or family care leave. So that could be caring for a seriously ill child, a child who has the flu, a child who has surgery, a child with a chronic health condition, asthma, autism. 15% of American families have a kid with a chronic special health care need. Or it's leave to care for a spouse or a partner who's got a serious illness or a disability, or a parent, right, or a grandparent who's got a serious health condition. Your mother falls and breaks her hip. She needs help getting into rehab or getting home from the hospital. So these kinds of leave are covered under the Family and Medical Leave Act, and they're covered under the 6 state laws that have been enacted that provide paid family and medical leave.
That's unpaid leave at the federal level.
The federal level, it's unpaid but job protected, and so the states...
For a period of time, 12 weeks.
Up to 12 weeks per year.
So for people who are providing long-term care, and it's family members who provide most of the long-term care in this country, we tend to think about nursing homes as the place where it's provided, but only about 4 to 5% at most of long-term care is provided in nursing homes. It's mostly provided in people's homes, some of it with home health workers, but the vast majority of it by family caregivers. It actually constitutes somewhere in the vicinity of 15 to 20% of all health expenses. So if they were paid, it would add 15 to 20% to the cost of health care in the United States. So
as you know, many of these caregivers, because they can't reconcile work and these kinds of ongoing caregiving responsibilities, they just leave the labor market altogether. Right. So they're older workers, they leave the labor market to care for their spouse or their partner or a parent. they stop contributing to Social Security, they're claiming early. This is costly to everybody, and it's also not great for their health and their mental health.
Well, they burn out.
They burn out. Same thing with caregivers of kids with disabilities. It's the same thing. So these kinds of programs enable people to stay and work and have the kind of job-protected leave that they need, so they don't have to choose between their jobs and their caregiving.
Well, we should also mention that when Medicaid is involved, there is something called a consumer-directed in-home care program, and in fact, the people who are receiving care can use their Medicaid to pay their family members to provide care. I think very few people know about that, and it's underutilized. That could be developed much more. I'm interested in the politics of this as well. We're going into a presidential campaign.
Yeah.
I'm a cynic in the policy world. I've done policy many years, and it just feeds my cynicism. So I'm assuming that if you had a bunch of people there who were really interested in what you had to say, they see this as positive politics in some way.
Well, all I'm going to say is that I've been down to Washington twice since that hearing. So I've been down like 3 times in the last 3 weeks to talk to people about possible bipartisan legislation for paid family and medical leave. So whether this will go somewhere in the next 2 years, that's, above my pay grade to predict. But they are talking about it. So Senator Cassidy, who's a Republican from Louisiana, and Senator Sinema, who's a Democrat from Arizona. She got the seat that was vacated by Jeff Flake. They have agreed that they're going to work together on some kind of bipartisan paid family and medical leave legislation. The contours of that are not established yet, but they are working together. And so something may be happening. I think there's some recognition on both. Laws are passing in state legislatures, not just with Democratic votes. Do you know what I mean?
Yeah.
The first of these laws was enacted in California and was signed into law by a Republican governor, Schwarzenegger. These things are not just one-sided.
So this may become an interesting presidential campaign issue as well.
Yeah.
But maybe we come back to that. We have a question, so why don't we take that? Are there any states that are currently providing models for paid leave for working class families that could be adopted at the federal level?
Yeah, it's a great question. So California was the first law that implemented paid family and medical leave. That's 15 years ago, back in 2004. Honestly, the reimbursement rate of their policy was low. They didn't do as good a job as they could have at outreach, getting the word out. The next states were Rhode Island and New Jersey. Each of those states was pretty limited. There were 4, 5, 6 weeks of paid leave. New York State now has what at the time it was enacted was the most generous law in the nation. So up to 12 weeks of paid leave. It's being rolled in incrementally. It started this year and is being rolled in. Washington State has also passed a very generous law and Massachusetts is now the third of those sort of new wave of states. So, each of the state laws, they're getting progressively more generous, and they're also addressing some of the issues I was talking about earlier in terms of which family members are covered. Is it just a spouse, or is it spouse and domestic partner? Is it just children, or is it grandchildren, recognizing that kids are living with grandparents?
Are all of them funded in the way that you described
They're all
earlier?
payroll funded, so they're all funded with a slight increase in payroll taxes. I think in every case, the increase is paid by employees only, not by employers. So employers actually don't contribute at all, as far as I know. I think that's correct. So I'd say I would always look at the most recent of the laws because they tend to get to be more generous as they go along. But New York, Washington State, Massachusetts, all are kind of model legislation. And there is model legislation filed in Congress, the Family Act. I'd say stay tuned. This is going to be a live issue in the presidential
We have
campaign.
another question here. I live in a rural conservative area and have found that there is a stigmatization around taking time off to take care for a relative because it is viewed as outside the traditional social norms for the area. It is sometimes labeled as a way to get out of work. This is a barrier for people here. Is this seen in other areas?
There is a lot of concern about when you get into the terrain of whether it's for your own illness or taking care of a family member, are people going to abuse this? Are people going to say, oh, I've got to take care of my great Aunt Mary this week and my great Uncle Joe next week and then Cousin Sue, and then we've all seen this. You know, what funeral are you going to next week? You know, sometimes if you're worried about an employee, you talk to the state administrators who administer these programs. There's very strict verification in terms of either your own illness or the person you're caring for. So doctors have to submit notes, and then they use codes for the illness to determine how long you should be providing care. Mm-hmm. So it's actually a very well-developed system, and there are very few concerns on the part of the administrators about abuse. So it's the kind of thing, these are sort of myths, but when the programs are actually enacted, they're quite strictly enforced. You know, it's ironic that there should be concerns about it because some of the more conservative areas would also be all about family values and families taking care of each other. So if you can take some time off work and help when your mom falls and breaks her hip and get her some rehab at home instead of having her go to a nursing home for rehab, that's better for everybody, and it saves an awful lot of money, and it's consistent with family values.
Now that's
so sometimes it's just sort of asserting that. There actually is one study in California. It's not my research, but I love this study by Doug Wolf up in Syracuse, showing that the California law actually led to reductions in nursing home use. And we think it's exactly this kind of situation where it's the short-term sort of rehab use of nursing homes that goes down because caregivers are able to arrange other care in a person's home.
Certainly consistent with the goal of long-term care reform, which focuses on less utilization of nursing homes and shortening length of stay. We have an interesting question here. I assume, and apparently this questioner does as well, that when you're talking about the payroll tax, this is a universalist program. It's for everybody. So this person asks, do you think it could be viable to introduce this on a federal level as a means-tested program?
So that's an incredibly perceptive and timely question because actually the Republican Senator Cassidy, who's working on a bipartisan effort, this is actually something that he's floated and is enthusiastic about, would be a means-tested program where this would only be available to people below a certain income level. I have to say there's nowhere in the world that does that. I mean, literally nowhere in the world has a means-tested program, and none of the states have a means-tested program. As somebody who studies welfare state programs, I guess the concern I have about that is we talk about sort of benefit traps and poverty traps. So I think Senator Cassidy was talking about a $70,000 cap. If your income was below $70,000, you would qualify. If your income was above $70,000, you wouldn't qualify. So you have a job, you're getting paid $67,000 a year, and your employer offers you a promotion to $72,500, and you turn it down because you don't want to disqualify yourself from the program, and so you're then trapped in the job that you're in, which nobody would want. So it's kind of a wacky idea, honestly, to use a
also
technical
has
term.
political implications.
No, absolutely. So what all the states do, which is a really smart way to use the money, is you try to have the replacement rate as high as possible. So you try to replace a pretty high percentage of people's wages while they're out, but up to a pretty low cap. So you don't want to be throwing a lot of money at more affluent families who don't need it because they've got savings to draw back on and because also they have paid leave on the job. You want to target the money you're spending in benefits to people who are lower income. So the way you do that is you have a cap on how much of the earnings you're willing to replace. And that's a way of targeting the benefits while having it still be a universal program. So I think people welfare state folks refer to that as targeting within universalism. Yes, you try to give the most money to the most needy, but within a universal program so it has universal support.
So
you don't want people to feel like we're all paying into payroll taxes, but she gets to claim and I don't. You want to try to make it as broad as possible so you have broad public support.
Right. One more question. In your experience, are there states extending this leave to foster parents?
Well, I was saying before, the parental leave covers if you're giving birth to a child, or you're a new parent, or you have a newly placed adoptive or foster child. So yes, you can get parental leave if you have a newly placed foster child with you. And boy, I think you would also be able to get leave if you were caring for a foster child who was seriously ill. I think they would count as being one of your children.
Would you get paid leave in that case? Since
in the
as a
States,
foster
yeah.
parent, you're getting paid a fee to serve as a foster parent. So would you also get?
Yeah, no. I think if you're a foster parent, you're getting paid to cover the child's living expenses.
So you're not getting anything beyond that. That's
No.
a form of compensation. So
No.
you would need the paid leave.
You absolutely need paid leave, just like any other parent does. Yeah,
Okay.
yeah.
Are there other questions, or have we? We've run out of questions at this point. So let's go back, if you don't mind, to the presidential campaign, which is very much on my mind.
Yeah.
What do you think? We've got people out there now who are talking, among the Democratic candidates certainly, they're talking about the way in which the less affluent part of our society, to put it excessively politely, are not doing well, and the need to introduce programs that will address the problems that they're experiencing. Do you think this becomes a viable and important topic for presidential candidates? Should they be talking it up?
Yeah, so, even the last presidential election, that was the first presidential election where candidates in both parties talked about paid leave. So Hillary Clinton obviously talked about paid family and medical leave as well as child care. But Donald Trump talked about paid maternity leave. His daughter talked about paid parental leave. Marco Rubio talked about paid parental leave. So that was really the first presidential campaign where both parties were talking about it. And this time, I think it'll definitely be on the agenda. Senator Gillibrand from New York is one of the sponsors in Congress of the Family Act, which is sort of the paid version of the FMLA. But a number of the other candidates will be talking about it. And childcare is obviously a topic on the agenda. The other thing that I've been following is the number of proposals that would increase or extend the child tax credits to be more generous and to reach more families, including through refundability, so that you get something closer to a child allowance, which other countries have. So at the school has a very active center on poverty and social policy that I'm involved with, and we've been actually modeling all of the presidential candidates' proposals around the child tax credits, around guaranteed jobs, and we're now working on the child care proposals, and we're going to start to look at the paid family leave proposals. It's great that there's a contest of ideas around how to reduce poverty and improve the living conditions of low-income families. And we have the skills and the capacity at the school to be modeling these. So I would encourage people to look at, it's the Center for Poverty and Social Policy at the school, and we have a series of policy briefs where we're analyzing these presidential proposals. And we're honestly having a hard time keeping up with all of them because there are so many. We're working on the child care ones now, but I would say stay tuned.
So people will be able to find out what the presidential candidates are actually advocating for.
What they're actually advocating and what they would actually mean in terms of reductions in poverty.
So let me just change that a little bit to talk about, we have another question, and it's the last question. So I won't ask you my question. We'll go to this question. Which countries have level playing fields for working class families, and where does the U.S. rank on this measure?
Well, I mean, I can answer in terms of child poverty, we rank the worst. I can answer in terms of paid family and medical leave, we rank the worst. So on average, across our peer countries, in terms of paid parental leave, last I checked it was 10 months, but I would suspect it's probably 12 months now. So that's 12 months, 1 year of paid parental leave, and they all have other kinds of leave for family caregiving or for caring for an elder relative or a sick child or your own illness. So we are so far behind. Yeah. We have a long ways to go.
Very distressing news. Any recommendations for students who want to get away from direct service and move into policy work? I think the Nike answer is the best, but go ahead.
Yeah, I mean, it's exactly the transition that I made. We were talking earlier. I was a child protective services social worker for 3.5 years and then moved into policy. I mean, at some point, you just sort of see the same issues affecting the clients you're working with over and over again. And you want, depending on who you are and what you want to do, some of us then want to move into working on a larger scale and working more systematically. So that's the transition I made.
I made the same transition. I started as a clinician.
No, exactly.
And exactly as you say, I was working with seriously mentally ill people, and I looked at their lives. Yeah. And they didn't have a decent place to live, and they didn't have enough money to live on, and they were in danger constantly, and so forth.
So I would say, go for it. Come here to the school. We have an amazing policy concentration. We started the concentration the first year that I was here. The first year we had 5 students in the concentration. I think this year we had 60, 65. They're amazing students. Some of them work domestically. Some of them are interested in international. A lot of them go back and forth. We have an incredible policy faculty. I mean, actually, objectively, we have the best policy faculty of any school of social work, bar none. So it's an amazing place to study policy. So come study policy.
On that note, we're going to conclude today. I want to thank you for being here today.
Oh, my pleasure,
Very helpful and interesting conversation. Next week, Lauren Gates will be with us. She's the director of the Workplace Center here at Columbia, and she's going to be talking about vulnerable youth in the workplace. Work is absolutely essential to succeeding in this society. It's also a policy dimension.
Absolutely.
Which is often very neglected when we talk about what people need. So, Lauren?
They are the poorest age group. Young people, young adults are the age group with the highest poverty rate. It's staggering. So, we all need to be doing more work on young adults.
So join us next week. We'll be back talking about vulnerable youth with Lauren Gates, director of the Workplace Center. And again, thank you.
Yeah, my
Appreciate
pleasure.
your being here.
My pleasure.